Dash Dr. White here. Yinashia Anazo Nishlit to the Chini Bashichin.
Tachini Dashiche, Twitzni Dashinele. That's the first thing we're taught is our clans and how to introduce ourselves. You need to know somebody's clan because you need to know how they're related to you so you can always greet them and introduce yourself in the correct way.
Shiprock is a really unique place. We have a really long tradition of medical education. So over 2 decades of medical students and residents coming and rotating here and really learning a lot of skills and learning how to practice medicine in a rural area and with a really unique population. It seemed like the most natural step to develop our own residency program where we can train our own residents to learn what it's like to practice in this type of environment.
UNM reached out to us to ask if we wanted to partner to do a rural training track with them. So residents spend their first year in Albuquerque working at the University of New Mexico Hospital, getting all of the benefits of a big tertiary care center, all of the specialists and all of the variety. The second and third years, they come up to Shiprock, New Mexico, and work with us at our 50-bed rural hospital on the Navajo Nation, where the family medicine department has been practicing full-spectrum family medicine.
So I think one of the unique things about this residency is going to be the partnership with UNM. So being able to have access to a major academic medical center and being able to access those resources and specialty training, but then working in our community committed to Native health. I don't think there's another program like us where we're really focused on working with Indigenous populations and really committing to that mission.
This is the first residency program in the Federal Indian Health Service system, and it's been a real opportunity for us to reach out to the community and ask them what they want and their input and how they want doctors trained.
So I was both a student and a resident here. I loved it so much on my first time through that I came back as a resident. I loved it then again, and so I came back here to work as a doctor as my first job out of residency.
One of the things I really wanted to experience during one of my elective rotations was to come to IHS and be able to experience what it's really like. Even though I did my residency in a very academic institution, I didn't really know what to expect coming out here, but I was blown away by how similar it felt and just how collaborative all the physicians were, how the medicine that was being practiced was just so evidence-based and up-to-date and really didn't feel very different from what I was experiencing during my residency training.
When I was looking for a job, I wanted to serve Native American people, hopefully serve my tribe, but I was really looking for a hospital that had a great clinic, working for kind of a primary care model that really did deliver great medical care, public health, community medicine. I thought it was done very well here. I really think the teacher-student relationship and the doctor-patient relationship is like sacred.
With regards to patient care, I think having all of the services that patients need under one roof is something I've never experienced before, and I think it's a huge help.
I really love working with my colleagues in different fields here. We have pharmacists, we have pediatricians, we have general surgeons, obstetricians, midwives.
One of the things that I've really loved about working here is getting to take care of entire families and getting to take care of them when they're well and getting to take care of them when they're sick. If I see somebody in clinic who needs to be admitted to the hospital, I often will just admit them to the hospital from the clinic, and then I do rounds on them the next morning and manage their inpatient care as well.
For patients who have challenging social situations, challenging medical situations, having the same person walk in the door makes a huge difference.
We're really excited to be able to just work right alongside the residents too for any kind of procedures, whether it's on inpatient with paracentesis or thoracentesis, or in the clinic setting doing lots of derm procedures with skin biopsies, shave biopsies, joint injections. These are all things that we're gonna be able to do together side by side.
Well, the residents are here I would have to say they would have to, of course, go to the flea market on the weekend on a Saturday morning, get some local goodies, fried bread, tamale, Navajo cake, mutton sandwich.
One of the reasons that living in this area works really well for me and my family is that we really enjoy the outdoors. We have access to the desert and we have access to the mountains in Colorado nearby. And so it's 4 seasons of outdoors fun.
Yeah, there's so much to do in this area. I love the farmers market. So I think the Shiprock Farmers Market, the Durango and Cortez Farmers Markets are incredible, especially in the summertime.
And I will say this for anybody watching, I hike and I camp and whatever, but everybody else will tell you about those things. I'm the only person, I think, that tells everybody about the Crown Point Rug Auction, where weavers come from around the reservation and off the reservation with 1 or more rugs that they have made.
There's no lack of places to play basketball here. I just remember being struck by like how passionate people are about sports here, especially basketball, and just finding like local pickup games at Dene College, which is just like a 5-minute walk from the hospital.
Another thing that I would have to say that a resident would have to do is come visit the Northern Navajo Nation Fair. It's always fun. I mean, waking up at the crack of dawn just to go and find yourself a good spot at the parade. Going to Indian Market and looking at all the beautiful jewelry that the people sell. Also going to the powwow and just watching all of those talented dancers dance. Everybody here is like my family. Even in the hospital, I feel like everybody's my family. You walk down the hall, you see people, you say good morning. It's just nice to have all the support because you know how helpful they are and that they're here to help, like the Dene people, like my people, they're here to help us.
And to help this, the community is all extremely important to me because this is my family.